Breast cancer is one of the most common cancers observed in today's era. Most women who get it, 8 out of 10, are over 50 years of age. But younger women and in rare cases can also be diagnosed with this invasive approach. It can be treated early enough. It can be prevented from getting to the other body parts. The breasts. The breasts are made up of fat, connective tissue and thousands of tiny glands known as lobules, which produce milk. When a woman has a baby, the milk is delivered to the nipple through the tiny tube called ducts, which allows her to breastfeed. In cancer, this orderly process of cells goes wrong and the cell begins to grow and multiply uncontrollably. Symptoms of breast cancer. It can have a number of symptoms, but the first noticeable symptom is usually a lump or area of the thickened breast tissue or cells. Most breast lumps aren't cancerous, but it's always best to have them checked by a professional doctor of it. The symptoms that can be observed in the condition of breast cancer: a change in the size and shape of breasts, discharge in the less milk from either nipple, a lump of swelling in either of the armpits, rashing of the skin of your breast, a rash or around your nipple, a change in appearance of your nipple, such as becoming sunken into the breast. Types of breast cancer. There are several different types of breast cancer, which can develop in different parts of the breast. Non-invasive breast cancer. It is cancer which is caused by cancer or carcinoma in situ. This cancer is found in the inner duct of the breast and doesn't spread and develop outside the other area of the breast. Invasive breast cancer. The cancer type has the ability to spread to the other body part. This doesn't necessarily mean it has spread. The most common form of breast cancer is invasive ductal breast cancer, which develops in the cells that line the breast ducts. Invasive ducts breast cancer accounts for about 80% of the cases and is sometimes called nonspecific. Other types of breast cancer. It's possible for it to spread to the other parts of the body, usually through small glands that filter bacteria from the body or the blood. Cancer screening. Mammography screening is one of the common techniques employed in the screening of it, where X-ray images of the breast are taken, and is the best available method of treating an early breast lesion. However, one should be aware that a mammogram might fail to detect it. The best way to deal with it is to remove cancer-affected part by the surgical process, as it is not an easy task to perform. Women with higher than average risk of developing breast cancer may be offered with screening and genetic testing, and other developed techniques, treating breast cancer. If cancer is detected earlier, it can be removed at an earlier stage. With its treatments are available with a combination of the different techniques, like the common methods of treating a surgery like radiotherapy and chemotherapy. Surgery is usually the first treatment to deal with, followed by chemotherapy and radiotherapy or the biological treatment. In a small proportion of women, the cancer is discovered after it's spread to the other body parts, known as metastasis. Secondly, cancer in this category is the advanced metastasis, which is curable, but it's always advised by the doctor to take a keep at the look of their body and regular checkups. Preventing breast cancer. As the causes of breast cancer are not fully understood, it's not possible to know if it can be prevented altogether. If one is at an increased risk of developing the condition, some treatments are available to reduce the risk of cancer by as much as a third. This is because being overweight or obese causes more estrogen to be produced. Living with cancer. Being diagnosed with cancer can affect the daily life in many ways, depending on what stages it's at and what treatment you're having. How women cope with their diagnosis and treatment varies from person to person. You can be reassured that there are several forms of support available. Your family and friends can be a great supportive system. You can share one's thought with others in the same situation. Find out as much as possibilities about the situation. Don't try to do so much expert yourself. Make time yourself.